change that you wish to see in this world? The great world leader Mahatma Gandhi said that many years ago, and I have really tried to live my life like that. I also love the theme of this year's TEDx Youngstown, breaking boundaries. And when I think of breaking boundaries, I think of my parents who are joining us here this afternoon. They broke boundaries by coming to Youngstown, Ohio, from the country of the Philippines, to find a better life. And this is where I was born and grew up. Went to Cardinal Mooney High School, Youngstown State University, Neomed for medical school. And now I'm a family physician in Salem, Ohio. I just love this community, the hard-working community of Youngstown, Ohio. And when I reflect upon breaking boundaries on myself, I had to think a little bit. But I'm a physician who's an early adopter of using social media and the internet and talking about medicine. And I've been teaching social media literacy to physicians all across this great nation. I've been speaking all across the country, from Alaska to California, from Maine to Florida, and everywhere in between. And I tell them a lot of things, but the main thing I tell them is this, and I'm quoting my good friend Dr. Brian Verdabedian, who works at Texas Children's Hospital, and he's a physician social media leader. And he says this. He says, physicians have an obligation to share what they know on social media. It's a pretty powerful statement. Because if we don't, bad things happen. Let me give you an example. The year is 1998, and 4 things happened that year. 1, I was married. My wife is with us this afternoon. We met here at Youngstown State. Secondly, I graduated medical school. Third, an interesting study came out that year, written by a guy named Andrew Wakefield. Now, you may not know the name, but you definitely know what he said. In this study, he said vaccines cause autism. And that changed things forever. Now, to let you know, that study has been debunked, and that gentleman has been discredited. Vaccines do not cause autism. But still, this week in my office, I'm having that conversation with parents of my patients. Why is that? The 4th thing that happened in 1998 was the founding of a small company, you may have heard of it, called Google. And even today, if you Google vaccines and autism, you see all this anti-vaccine propaganda. And medicine really missed the boat on that. And you can see complications of that in the news this very week. The happiest place on earth, Disneyland in California, has an outbreak of the measles, one of the M's in the MMR vaccine. So people ask me, why do you do what you do on the internet, on social media? One reason is I'd like to correct some of that misinformation that's out there. A lot of the leaders who are physicians in social media started their careers because of that study and what happened after that. The other thing that I'm really passionate about is my specialty, family medicine. I love taking care of patients. I love taking care of infants and children. Yes, many family doctors do that. I love taking care of older people, especially as they get towards the end of their life, meaning hospice care. A lot of family doctors do that. Did you know that? I love taking care of patients with diabetes and high blood pressure and other medical problems. You don't necessarily need to see 10 different specialists. You can just see me. I think every American deserves the care of a primary care physician, a family physician. But I admit that our specialty has not done a great job of telling all of you who we are and what we do. But that's going to change. If you get your phones out, maybe not now, maybe later. If you go to healthisprimary.org, and that will show you what some of my friends in family medicine are doing to help let people know what we do. I can tell you we take better care of patients. We give better health to Americans, and we do it at a reduced cost. That's called the triple aim of healthcare. If you increase the amount of primary care physicians and family physicians in a community, studies have shown that you will decrease the amount of deaths for cancer, for heart disease, for stroke. In those areas, those urban areas, and in those rural areas that increase the number of primary care providers in that area, they have shown a decrease in infant mortality, an increase in birth weights, and immunization rates comparable to those nationally, despite their disparities. U.S. adults who have a primary care physician have a 33% reduced cost of their health care. These are the things that we talk about. That's why I'm passionate about primary care. I'm passionate about family medicine. I encourage you to join us at healthisprimary.org. But as I close up, I want to challenge all of you out there in the audience. We've heard it here right on the stage today. What are you passionate about? What are you excited about? What are you upset about? I challenge you to share that on digital media and social media. My friends who are social justice advocates, they recognize the power of social media. Whether you go off to foreign lands, to things like hashtag Je suis Charlie, or even back in this country with recent events, hashtag I can't breathe, or even this very week, hashtag Deflategate, or hashtag I won both of them, or hashtag TEDxYo. If you do not stand up for what you believe in, who will? And how will you break boundaries? And how will you be the change that you see in this world? My name is Mike Sevilla. Thank you very much.